I remember clearly the conversation that took place when we decided to commission a service like Integrated Plus. It was actually in this room that I'm sitting in now, and it was with myself and the CCG accountable officer at the time, Paul Moback, with Andy Gray and with Kate Green and Neil Buckton. So Kate Green and Andy Gray from Dudley CVS and Neil Buckton also from the CCG at the time as the head of commissioning, where we had a conversation in this room about what is the gap and what needs to be filled. And the gap that we identified is a role within the community that worked with the community. I'm not going to call them patients, I'm going to call them citizens. So worked with people to help them address life issues. So many of the issues that people come across that actually end up encouraging them to head towards health services when it isn't necessarily health services that they might need. So a lot of people that might go towards their GP for help, they're not really clear what they need help with. They might be suffering with loneliness, or they might be suffering with just problems with day-to-day life. Not necessarily mental health issues, but just helping them navigate through life and what services might be able to help them. So around this table, we talked about the kind of service that we might want to commission, and the service, which is now known as Integrated Plus, was born. The service and its name actually came fortuitously out of the integrated care model that we were developing at the time. So going back some sort of 6 or 7 years ago, when we were looking at the development of multidisciplinary teams and bringing together those professionals across health and social care to come together to have conversations about people who are vulnerable within our community. We talked about an integrated model, and the Integrated Plus service does exactly what it says in the tin. It adds to that integration model. So the term of social prescribing has since been developed to really focus on working with people within their social circumstances, working alongside health, working alongside social care, to really help people move forward and address some of the problems that they're experiencing through life. So as part of a wider development that we did within Dudley as part of something called the Vanguard, which meant that we were chosen to be an area that really progressed different innovative areas of practice with regards to integration, the Integrated Plus service was commissioned and developed, and it has grown from strength to strength. I clearly remember the GPs just within Dudley, within a few months of the service starting, describing the Integrated Plus service as the gold of the model, and it remains the same today.
The Integrated Plus Social Prescribing Service was established in 2014 in response to the new integrated care model. The idea was born out of an aspiration to offer residents of Dudley Borough support that was kind of flexible, non-clinical and holistic. We wanted to offer an approach that focused on the whole needs of a person, whatever they might be, and jointly find solutions to problems faced. Issues could be really wide-ranging, from debt, housing, isolation and loneliness, family issues or mental health problems. We named the new roles Voluntary Sector Link Officers, who could identify opportunities for people to become more involved and active in their community to help improve their well-being. With the new multidisciplinary teams about to be launched, it was felt integral to have some non-clinical roles as part of these, representing the voluntary and community sector and bringing to the table non-clinical interventions alongside clinical support. When recruiting for these roles, we were looking for some key qualities: people who are passionate about people with a really good understanding and knowledge of the voluntary and community sector, and people who would truly go the extra mile. It did not take much time for the Integrated Plus service to become a valued service from residents and MDT staff. In the first year alone, the service received just over 1,000 referrals, with heartwarming success stories from the people we worked with. GP and A&E visits began to reduce, and people were actively participating in a wide range of community activities and services. The success of the Integrated Plus service kind of led on to the development of the High Intensity User Social Prescribing Service in 2018.
The High Intensity User Service was originally funded from what was the CCG and Department of Health monies, targeting people who use urgent care services frequently, such as presenting to A&E or calling West Midlands Ambulance Service. The model allows for a small caseload but high intensity work over a longer period, using an asset-based approach, flexible working to help people overcome barriers, integrating into their communities. It utilises a flexible person-centred approach, taking time to build rapport with the service user, understanding why they present and looking to put interventions in place to try and support them at home rather than keep having to access these urgent care services. The HIU service has helped reduce demand and has saved the system money, but ultimately it's helping to improve the health and well-being of the people being supported.
More recently, we've seen the addition of our ARRS staff to our PCNs. This has expanded the capacity in social prescribing. The staff we now have in our PCNs include our social prescribing link workers, health and wellbeing coaches, care coordinators and listening and guidance. It means our patients have access to extra support for improving and maintaining their health, both physical and mental health, over and above what the clinical staff can offer. It encourages our patients that with support they can make positive changes that will help them feel better, and that medication isn't always the answer. As a GP, it's always hard to keep up with what services are available locally to signpost patients to, but our link workers are experts. We've got bereavement and loss support from listening and guidance, and support from our health and wellbeing coaches for our patients to make lifestyle changes and maintain them in the longer term. Our care coordinators are the glue that holds all of this together. They support patients with some of the most complex needs and ensure that the patient's individual care plan all comes together. When discussing patient cases at an ICT meeting, it always feels with our social prescribing team that there's no challenge that they won't accept. If we ask who can help, they've always got an idea and they'll always see the patient and do what they can to help. They're great at thinking outside the box and considering things that clinical staff hadn't. The expansion of the team means that our patients will truly be able to access the bespoke support package that they need from the teams and people that they need it from at the time that they need it most. As well as supporting adults, Dudley's been one of the first areas to adopt a social prescribing service for children and young people.
Here for Youth started providing social prescribing for children and young people towards the end of 2019, with 3 dedicated link workers supporting people aged 11 to 25 and their families. These workers operate across the 6 primary care networks, and they see young people wherever they feel most comfortable, including GP surgeries, schools, colleges or community venues. The link workers are based as part of the wider Here for Youth health and wellbeing service, and they contribute towards the Thrive approach and model by providing a range of different support across each of the Thrive quadrants. I believe our link workers have a key role to play in supporting young people to maintain and improve their personal well-being. They provide supported connections and onward referrals across Dudley and within Here for Youth. They work closely, they connect young people with a range of our partner agencies, utilising the on-site access to support services such as sexual health and career opportunities. The link workers can also access Here for Youth structured intervention programmes such as our Poor Impulse Control programme, Personal Development programme and Managing Emotions. The link workers also can access Here for Youth's personalised care plan substance use support for young people aged under 18. Due to the higher age range that our social prescribing works with, we feel particularly proud that we have the opportunity to support young people who are in transition between children and adult services. We work closely with our adult social prescribing colleagues and teams to ensure that we can provide the best fit service. And by having a specific children and young people social prescribing team means that we can intervene early. We can support young people with their non-medical needs, and we can reduce the escalation of any behaviours or risks. Demand for our link workers is high. Young people and families can access Here for Youth in a number of ways, including our walk-in, self or professional referral, or our online booking process. Therefore, we feel that we are an accessible service and we have no waiting lists. Our link workers have been connecting with other social prescribers within Dudley Social Prescribing Connect and Share sessions.
Dudley Social Prescribing Connect and Share is a network that meets bi-monthly. It brings together all of the link workers from across the borough and staff in other personalised care roles. It enables them to work together to share learning and good practice, and also to come up with solutions to any gaps that they identify. In recent years, the service has developed to realign itself with the 6 primary care networks. This has enabled the link workers to become embedded within their integrated care teams and also play an active role within the integrated care team meetings. We've also expanded our volunteer team at Integrated Plus. This includes community buddies who are able to help people who are lacking in confidence to access new services and activities. We also have a huge team of allotment volunteers, some of which are here today at Horbush Community Gardens. They provide a welcoming space for people who want to come along, meet new people, have a drink around the campfire and work on the allotments and other projects on the site. A vital development that happened within the Integrated Plus service was the introduction of a Social Prescribing Fund in 2018. The fund has meant that we're able to commission new services and activities based on the needs and the gaps that arise. Some of these have included debt support and advice, support with benefits. It's involved creative activities such as walk and draw, activities here on a Wednesday, activities at Riverside House, so things such as blacksmithing and greenwood work, team building over at Baggeridge Adventure Centre. It's really important that we have this fund, as this enables us to continue to invest in the voluntary and community sector. As without a thriving voluntary and community sector, social prescribing cannot be effective.